Advanced care planning it's about a conversation. It's also a lifelong conversation.
Advanced care planning is really for everyone. If you're 18 and older, you can come up with a plan with your provider and with your family and your loved ones about what you want for your health care.
I think advanced care planning helps get everybody on the same page in the family.
At South Central Foundation, we use the term customer owners for patients. And patients, we feel that they have equal ownership in their healthcare goals, and it's a partnership. Advanced care planning is a conversation about, number one, who knows them best and who is the spokesperson that can help to speak for them in a time where maybe they have a serious illness or injury where they're unable to speak for themselves. It's also an opportunity in that conversation of advanced care planning to be able to describe what's important to them, what matters most to them, especially around their medical wishes about the types of treatments that they want or may not want.
I think the important conversations that need to happen when you're dealing with families who are Alaska Native or American Indian people is understanding their culture, because I know what we say is a tribe is not a tribe is not a tribe. We're all different.
Advanced care planning conversations, I think the earliest that you can initiate them early on before there's really changes in physical condition or any kind of illness that's progressing, the earlier you can capture somebody's wishes and intentions, the better.
At South Central Foundation, we start these conversations when someone's age 40. We realize that at age 40, a lot of people are starting to get their screenings, and they're starting to think about proactively and preventively how to stay healthy.
Advanced care planning is so important for people living with dementias and Alzheimer's because as that disease progresses, so does decision making and so does their cognitive capabilities. I would start having these conversations about advanced care planning by first making sure that you're not making any assumptions about what you think you might know about a person. Asking lots of questions, making those questions open-ended, asking about their culture, their traditions, asking about who is in their life. The first topic that's discussed in care planning is usually identifying a healthcare agent or the person that the patient feels most comfortable with speaking for them if they're unable to speak for themselves.
Who knows them well? Who knows their values and their wishes? Who do they trust? And then the other thing is, does this person, will they honor my medical wishes, even if they're different than their own? Will they still honor and advocate for the customer owner's wishes?
The people involved in the care planning for my mom and my dad were mostly myself, but I did have the assistance of my brothers and my sister. So I could get information. My brothers and sister could get information because we were all listed. And because my parents had signed, it was okay for them to get information, healthcare information when we needed it. And so that was incredibly helpful, just to be able to do that and not worry about being turned down when we put in a phone call or going into the hospital and, being asked who we were and not being given information.
And so I always encourage our providers that many customer owners, they want to have these conversations and be engaged in talking about their goals.